We made every compromise we could so that we could afford to have food in the house.
That is the reality for one Idaho family, and they're not alone. A new study shows Idaho ranks second in the nation for the rate of children becoming uninsured, with about 40,000 kids in the state currently without coverage. Aspen Shumper joins us in studio with more. Aspen, there's a study, right, showing that this links directly to changes in Medicaid eligibility.
Right, stemming from state re-examining household income eligibility levels post-pandemic.
It's a rock and a hard place.
When the pandemic hit, Congress extended Medicaid coverage to ensure everyone had access to health care.
When my ex lost his job right as COVID hit, we were absorbed into that extended Medicaid.
Idaho Department of Health and Welfare didn't check eligibility for 3 years. But Ivy Walker with Idaho Voices for Children says the department started to in 2023 during a process called Medicaid unwinding.
The Department of Health and Welfare's Medicaid division going back through their roles and trying to figure out if people were still eligible.
A September 2025 Georgetown University study reveals between 2022 and 2024, during the unwinding, the state of Idaho saw about a 40% increase in the amount of kids who became uninsured. Only Texas has a worse uninsured rate in children than Idaho. The study shows the drop in insured children was related to Medicaid eligibility.
As someone who has been on Medicaid themselves, I can just really empathize for the families who have essentially been getting all this whiplash of all these different changes when these are just folks who are trying to get by.
I've been in Idaho for 20 years.
Randy LaSalle's two oldest children managed to remain on Medicaid through unique qualifications, but her two youngest sons were dropped.
They said that we made over the limit, but when I did the numbers myself, we were still $75 under the limit. And I had to add the kids to my insurance, and it was $800 a month. That's more than I pay in rent.
Every day, LaSalle says she had to make tough decisions about groceries, bills, and activities.
It was very hard because we went from being able to once a month go and do something and be a family and get out and do something to my accounts in the negative.
Before to live, she had to pick up 3 jobs.
So I picked up a second job, and then eventually I had to get another job. So I would work my 9 to 5. Then on the weekends I would work another job. And then at night I would clean offices just to make sure that we made ends meet.
Walker says LaSalle's case is one of many in Idaho.
Coverage for children is not optional, it's foundational. It's a moral obligation for us to do better for Idaho's children. They deserve better.
LaSalle says she's not against requirements, but worries too many children like hers are being dropped.
And it's frustrating because the people in the families that actually need the Medicaid are not getting it. And I'm not saying we should hand it out to everybody. There definitely should be income limits, but it should be easily accessible for families who need it.
Her 2 boys were on her private insurance for over 2 years. LaSalle says each month they were pinching pennies, but with changes to their income, the boys have been back on Medicaid since June. Morgan, this is something that is definitely ongoing to watch as there's conversations at the state and federal level, and we'll continue to keep an eye on how this is affecting Idaho families.
Aspen, I really appreciate you personalizing this story, really putting a human face to it. Thank you so much.